Good morning, or just good afternoon, just turned afternoon here in Scotland and the rest of the UK. Good evening in China. We have one of our panelists in Beijing, and welcome to this event from the Asia Scotland Institute. My name is Martin Purbrick, and I'll moderate the panel discussion today and the interaction with the audience. We do want to hear your questions. With us is Roddy Gao, who's the chairman and founder of the Asia Scotland Institute. Also Rick Minchon, Head of Development of Asia Scotland Institute. And our focus today, obviously, is a discussion of the impact of COVID-19 and the pandemic on public health and social policy. I stress the last part of that title because obviously we're not looking to talk about specifically what's happening now, what's happened so far, although we might come on to aspects of it, but really what happens next and the impact of the pandemic on public health policy. And social policy, which I think especially Chun-Yi from Taiwan can say something about. If I could just introduce our panelists first, please. So we have Professor Linda Bauld, who's the Bruce and John Usher Professor of Public Health at the College of Medicine at the University of Edinburgh, and Cancer Prevention Advisor at Cancer Research UK. Professor Bauld is a behavioural scientist with a PhD in social policy, and her research focuses on two main areas, which are the evaluation of complex public health interventions and the use of evidence to inform public health policy. During the COVID-19 pandemic, she has served as an advisor to the COVID-19 Committee of the Scottish Parliament. So been in the heart of things, I think, in helping government to understand what should be the public health policy throughout the pandemic. Also, deeply involved in responding to the pandemic is Dr. Ruby Wang, currently in Beijing, working for the UK government. Dr. Wang is China Head of Health and Life Sciences Policy and Programs at the UK Foreign Office, based at the British Embassy in Beijing, and she leads the China Network team on bilateral and multilateral health policy and strategic designs, implementation and delivery of bilateral health and life science programs as part of strengthening health partnerships across the UK and China government, academia and industry. She's a trained NHS doctor, and not only an academic doctor, and was deployed to frontline NHS hospitals during the first wave of COVID-19 in the UK, which must have been quite an experience, Ruby. So really thank you for that experience. And we look to learn from you from that. And our third panel member is Dr. Chun-Yi, who is Associate Professor at the School of Politics and International Relations at the University of Nottingham. She's also Director of Taiwan Studies Programme at Nottingham, a board member of the European Association of Taiwan Studies. And her first book in 2011 was Taiwanese Business or Chinese Security Asset. But I think most relevantly for our discussion today, she's currently working on a public policy research project to compare Taiwan and UK government strategies to counter COVID-19. And as Chun-Yi and I just discussed before the audience came on, Taiwan has been through similar challenges before, not on the same scale, but those of us who were in Asia during SARS in 2003 have much to learn from that. Let's get started on the discussion, because I think for me, this subject is particularly interesting, not because we're in the middle of the pandemic, because we need to start thinking about what comes next and how the pandemic will change health and social policies. And I think that change has been witnessed before. If we look at pandemics and epidemics in our history, the Spanish flu from 1918, which claimed something between 50 and 100 million lives, according to modern day estimates, perhaps between 2.5–5% of the global population, clearly had a huge impact on the world at its time, somewhat overshadowed by the aftermath of World War I, perhaps. But it did have an impact on public health policy, most importantly. So what happens after this? As the WHO has reported 3.7 million deaths from COVID-19, over 170 million infections globally as of June 2021. Perhaps somewhat different impact levels, certainly the number of deaths, thankfully, but Spanish flu had a major impact on public health and policy making, in particular in relation to the socialization of medicine and healthcare for all in some Western countries. So there's something to say about what comes next from COVID-19. before we ask Linda what she thinks will be the long-term impact of COVID-19 on public health policy, Roddy, could I just hand over to you first for a couple of quick words of introduction?
Martin, yes, thank you very much. And thank you to all the panelists for participating today and all those who are following us through this webinar. I'm actually talking to you from the United States. And I really wanted to kick off our discussions by perhaps addressing this question to Linda, because in the United States of America, the reaction to mask wearing or not mask wearing, to what central government is saying or not, has become quite politicized. And whether this is an Anglo-Saxon trait or not, I don't know, but there is currently a row, even in Congress, as to whether people should wear masks in public gatherings. And I'd be very interested in your view on how public attitudes are affecting policy.
Certainly, thanks very much for that initial question. I know Martin will come back with the broader questions. So I think public attitudes have a big role to play in relation to how countries get through a crisis like COVID-19, what kind of society emerges from that, and what the outcomes are for individuals actually in terms of their health and their livelihoods. And I think the UK and the US have a number of things in common. They're both liberal democracies with, I think, going through, in recent years anyway, governments who really did emphasize an agenda around personal responsibility and liberty that is fed into the attitudes of some in the population. And so what you see in the UK is that early on, people were very, very reluctant to engage with restrictions being imposed on their lives, and also governments were unwilling to take quick action. But in contrast to what you would expect, if you look at multiple public opinion surveys, and I often refer to the excellent COVID-19 social study conducted by University College London, is that the British public's ability to adhere with things like stay-at-home measures, lockdown restrictions, movement restrictions, etc., was actually remarkable. And the vast majority of people did comply very quickly. And when we introduced face coverings, which was a big debate, and we did it very late, not really mandated until the spring of this year, and well, I think it's almost a year now we've mandated them, sorry, from the summer of last year, very late. Again, once they became required, between 70 and 80% of the population reported wearing them wherever they were asked to do so. However, when governments then started to ease restrictions, as is currently the case in the UK, there's about 10 to 20% of the population who are vehemently opposed to those kinds of restrictions. And you can see that in the opinion polls and don't want to continue adhering there. So it's been challenging, it's been divisive. And the final point I would make in response to your question is, globally, trust in government and trust in science has been an indicator of how well the population has been able to follow what is being asked of them. And trust in the UK government in particular has been relatively low, actually, in terms of how the population believe the government will guide the country through the crisis. And I think that has impacted on compliance. Interestingly, it has been higher in Scotland, significantly higher than in England, and a wee bit higher than in Wales. And there are arguments around, is that the communication style of the government doesn't take a more collective approach. But at the end of the day, we all share islands here in the United Kingdom, and what happens in one part of the country affects others. So the devolved nations have not been able to go it alone. But it's been a tough time, and we certainly haven't had the cohesion that a number of other countries around the world have had.
Thank you. Thanks.
Linda, thanks for bringing us up to date there. As you said, it is striking how in rather a small island we have multiple nations. For those who are coming in from Asia today, may not know, the United Kingdom is 4 nations in some ways, if you include Northern Ireland. But so we have multiple devolved governments, but we have a united central government, and I wonder what impact that will have on public health policy going forward, Linda. So perhaps you could tell us more about your views on that, the short and long-term impact of COVID-19 on public health policy in relation to UK, obviously where you specialise, perhaps in terms of devolved public health policy and central government policy. Will they align? Is there much of a difference in thinking, perhaps? And then if you could, a little bit more widely about how you think global public health policy is going to change after this. And again, on a more challenging level, will that be aligned given some of the difficulties we've seen with the politicization of the WHO in relationships with governments?
Certainly. So I think I'll just, in the sort of 8 minutes or so, I'll try and restrict my comments to. I want to sort of focus on 3 areas. The first one is, well, what are the outcomes been for the UK in this pandemic broadly? The second one, going back to the previous question, is something a little bit more about public attitudes and how policies have related to those. And then I'll say something, as you've just asked, about the relationship between UK and devolved governments for public health policy now, and then look ahead to ask, well, how might the pandemic affect public health policy in the future? So on the first one, I think it's really important to emphasize that the UK has not fared well in this pandemic, both in terms of the raw indicators that we use. So mortality from COVID-19, we've got about 130,000 people who've lost their lives. And if you use a more robust comparative measure, which looks at all-cause mortality, so that is all deaths from different causes, and whether they were significantly higher in the UK. And if you just focus on Europe, you can see in the first wave that the United Kingdom had the highest rate of all-cause mortality during the COVID-19 crisis. So that's back to the spring and summer of 2020. And in the second wave, which is the period we've just emerged from towards the end of the year of 2020 and the beginning of 2021, we were still in the top 10 European countries for excess mortality. Some of the Eastern European countries fared not so well. And within that, I suppose, spreadsheet, the highest rates of excess mortality were in England, and Scotland and Wales have had slightly better outcomes. But globally, we've been very hard hit. And I would point to 3 main factors to explain that. The first, and for me as somebody who focuses normally on non-communicable diseases, the first one is that we have a vulnerable population with high levels of inequality and conditions, including cancer, diabetes, heart disease, and the risk factors associated with those, overweight and obesity, for example, and the poor health that our people in deprived communities and shorter life expectancy normally experience. Those are the groups that have been worst hit by this crisis. So that's the first factor, and that's made the UK vulnerable. The second one is that the UK did not have the experience of SARS and MERS, as a number of other countries had, and I know we'll hear from the lessons of that previous experience, and we were slow to react and respond. There was my colleagues have argued there might have been some British exceptionalism that played out where we felt that it wouldn't affect us in the same way, and that we also may not have been prepared for the right pandemic. So measures to protect the population were applied slowly and not necessarily at the right time, and core public health responses like ability to test for a new virus, to apply contact tracing, support for self-isolation, and provide good behavioural advice to the UK public were not put in place as they should have been. And then as we moved through the pandemic and saw further waves of infection, as we just heard from Roddy, there was a debate amongst different parts of our government about a willingness to reimpose restrictions, perhaps as a preventative measure. And I think that affected us particularly badly in the second wave. So I'd summarize that as vulnerability, lack of a robust public health response. And then the third one is a more global issue, is the interconnectivity of the UK as an island and our economy and our dependence on international travel and those connections. And I think a lack of awareness that this is a virus which travels with humans, and it travels on airplanes and elsewhere around the globe. And even in the summer of last year, we allowed quite a lot of international travel, which I think has affected us not well. So we're learning from all of those 3 things. In terms of public health policies now, I just want to say something about attitudes and behaviours briefly, and then I'll move on to reflect on the longer term just briefly. The British public are very divided at the moment. We're opening up. You have a group in the population, Roddy was asking about this, who feel the government is moving too quickly, particularly at UK level. And to give you some examples, only around 20% of young people would feel comfortable going to a nightclub now, even though they are able to. Only about 30% of people say they'd be comfortable going to a large indoor event like a concert or performance, even though they're able to in many parts of the country. And a significant portion of the population, actually up to 2/3, feel the government's moving too quickly in easing public health measures. So it is a difficult time. In terms of policies, how will this shape public health policy in the UK first, and then looking ahead second, and globally third? Within the UK, public health policy has devolved to the different nations. They have taken slightly different approaches during this pandemic. For example, face coverings mandated in Scotland earlier, mass events affected earlier, and trying to apply a different policy to international travel, which was impossible to implement as we're so interconnected. I think that as we look ahead, the devolved nations' willingness and desire to have more autonomy will continue to be the case. And I think this crisis has underlined that debate. So that will be very interesting. In terms of UK public health policy, most of our colleagues in the field are completely diverted. And that means that we have seriously neglected the other conditions that need to be prevented or treated in this country, and that will have an impact for years to come. And that's not just cancer patients not being treated in hospital for 8 or 9 months and that backlog. It's also almost a complete abdication of looking at other preventative risk factors for disease. The colleagues who are expert in that are working on COVID, and I'm hoping that we can get back on track in that respect, but that's going to be a legacy. And then finally, looking ahead, I guess there's 2 big questions for me. We've gone through a period of unprecedented state intervention in the lives of populations in the UK and many countries. So the big question is, will the governments in the UK and elsewhere have an appetite to intervene to protect public health on other topics in the future and use their powers? Or will they actually say the economy is suffering and we need to allow companies to market their products, to operate, to increase their profits, and not worry so much about other health conditions or even inequalities? In other words, more of a free market approach to get us back on our feet. And if that's the way it goes, I think, unfortunately, public health will be deprioritized once again at a time when we should be building up our resources. And then final point, the UK is a strong supporter of the World Health Organization, of Gavi and COVAX, certainly in word and also in attempts to collaborate globally. However, we haven't played our part as we should have done in terms of providing vaccines to low and middle income countries yet. That is, of course, anticipated. And our vaccine program has been a huge success. But the global equity angle or issues, I think there are big questions about the UK's role in that. And I hope we can continue not just to be a visible leader, but actually in action to be a leader on that front. So thank you.
Linda, thank you very much. You covered a lot there, and some huge questions in terms of the UK and devolved nations within the UK. Approach, which I don't think we can answer in totality today, but we've got a good starting point. Perhaps we could go a little bit more widely now, and bring in Ruby from Beijing. Ruby, obviously, what we really want to ask you about in regard to public health policy from the pandemic is how do you see this differently from countries such as China or others in Asia, if you wish to comment on that? What impact has COVID-19 had on public health policy in China? And how would you see that, being a practicing doctor from the UK, as different from the UK? I'm sure your experience is probably paramount at the moment, actually, in terms of that comparison.
Thanks so much, Martin. So first of all, thanks again for inviting me to such a great panel. And thanks to Dr. Bauld for starting off the show really with some really great insights from the UK perspective. So I think I'll start off with a high-level summary, I guess, of some of the Chinese public health policies, breeze over the UK point of view. And then the really key factor that I want to drive forward today is what I think is really important. So kind of mutual knowledge sharing, bilateral and multilateral engagement and collaboration, because in a situation when COVID is unknown from all of us, and we're all still learning about how to face this virus in this pandemic, whether that's unknown vaccine efficacy now in the face of Delta, whether that's unknown regulation policies and how to decide travel restrictions or vaccine passports, whether that's unknowns in how to actually manage COVID on the front line. How we decide these on a policy level, on a clinical level, on a societal level is not just important for health systems, but also for our society and our economy. So as Martin mentioned, I'm currently working for the health team for the UK government in China from the British Embassy in Beijing, but I also have my clinical hat. So I was there in London for the first wave of COVID throughout the start of 2020, and I only came out to Beijing in September of last year. So it's been really interesting having that comparative perspective across both of these countries. So first of all, China's policies on public health. I think, you know, from the UK side and from the West, everyone watched as China went into totality of lockdown in January, and then also in April of 2020 came back out very rapidly, released from lockdown and quarantine. And I think from the West point of view, you know, everyone watched this with pretty much amazement. There was nationwide coverage of the quarantine and the speed of the lockdown, and the fact that all populations of multiple cities, especially Wuhan and Hubei province, managed to implement this was pretty incredible compared to what other countries were used to in their own systems. And moving from this lockdown, also from February onwards, the Chinese government implemented policies to protect medical workers. They built up temporary hospitals in Wuhan, for which the UK and other countries also looked to implement. Changing conference centres, changing stadiums to make them work to deal with more cases, policies to make COVID treatments free for the whole population. That was a first in China. Policies on the digital space, which was really interesting. So the Chinese government integrated online medical services and chronic prescriptions into insurance, but also made major moves to promote internet hospitals throughout the pandemic. And internet hospitals are a really interesting concept in China, which move offline into online across clinical consultations, across prescriptions, and even insurance. Apart from that, we've seen QR codes being used for entry and exit into public spaces, and of course, the travel restrictions upon entry, as well as visa and 2-week quarantine and hotel, which has remained mandatory from then until today for China. Apart from this, also we've seen changes in vaccines and medicines, regulatory standards. This has been undergoing a bit of a slower change compared to the frontline policy changes, but still boosted by the pandemic, we see China's government paying more attention onto regulatory standards, which has been essential for COVID vaccines. Also looking at more efficient health technology assessments, value-based procurement, competitive pricing to improve accessibility to healthcare services and products for China's population. And not just safer vaccines and medicines, but vaccine uptake as well. So traditionally, we know that the UK is very strong in implementing nationwide seasonal flu vaccines, for example, but COVID has really been the first infectious disease rapid deployment of vaccines across the nation. And China's been doing this very rapidly. So based off the backdrop of all of these policy changes is China's health system environment. So the lack of integration of rural to city. Linda Bauld mentioned just now the variability of access, the quality of services in the UK, but in China, this is a much greater disparity. So from rural communities to tertiary hospitals in cities, a lot of variation in the quality of care and the accessibility of care. So the lack of doctors, 6.41 per 10,000. That's very much lower compared to the UK. So major shortages that were further burdened and exacerbated throughout the pandemic. So seeing these policies being implemented in China, the internet hospital policies, the access of free medicines and services for the population, that's made huge differences in China. China has recognized its own gaps and challenges in healthcare, and the pandemic has promoted rapid shifts and attention in healthcare like China's never before. So China had the Healthy China 2030 major policy, but the COVID pandemic has really seen rapid movements in infrastructure upgrading and decentralization being a focus, training more staff and using technology to better advantage. So all of those have had major impact in China's public health space. In terms of comparatively across the UK, I think Linda Bauld has already talked extensively about the changes in the UK, so I'll kind of breeze over that, but obviously we've seen lockdowns, mask wearing debates, technology utilization, so telemedicine and remote consultations, UK attempts to utilize Digi in better ways in terms of population integration, for example, track and trace apps, as well as travel restrictions upon entry and quarantine as well, easing and re-restriction of that, changing as we see different ways of COVID moving through the UK. And of course, vaccine uptake, again, being something that's been touted as a major success in the UK. So again, these UK policies aiming comparatively to China to impact the social disparities in the NHS and patient access. You know, we know that the NHS has been stretched every winter. It's been a long-standing crisis, and something I myself, you know, previously as a doctor in the UK, you know, felt very closely year on year, but really COVID has seen that impact the workforce even more strongly. So how can we use a stronger digital infrastructure to overcome that, and how can we use a cross-government strategy with different sectors working together, not just the health sector, not just the Department of Health and Social Care, but also the Education Department, the Transport Department, the social departments, working together, balancing scientific research and evidence, balancing medicines regulations. We saw the UK MHRA being the very first in the world to approve the AstraZeneca COVID vaccine. So all of that has been really, really interesting, seeing how the UK is using policy mechanisms in order to build back better, as we are saying. So overall, I think it's been interesting comparing how the cultural backdrop, the social culture and society backdrop of the UK and of China have impacted effects of how we manage the pandemic in different ways. And as I mentioned earlier, as the Delta variant spreads, this provides more and more unknowns. You know, in science, we are still learning, we are still immature on how we manage COVID. We're still moving through what we cannot call fact quite yet. Trials are still ongoing, and opinions find their way in, and politics find their way in. And this makes decision-making very difficult for policymakers. We don't know what is correct or what is not correct, and there will always be loss somewhere, whether that's loss of life, as we've seen, loss of economy, as we've seen, and how do we trade this off? This is a very, very difficult question. So my main kind of point here to make really is that in the face of unknown, really, we must kind of band together and work together more strongly. And that's part of my role here in Beijing, how to get the UK to share their strengths in the NHS, in the expertise of the world's longest universal healthcare system. The UK is very strong in its primary care, very strong in its NCD management. How can it work together better with China, which we've seen has implemented pretty incredible policies nationwide and has the world's largest population size, which alone means that, you know, the impact is seen greater and faster. So how can we continue bilateral and also multilateral engagement and collaboration to overcome the shared unknown? Martin talked about in his introduction, focusing on what comes next. And, you know, we really can't tell, epidemiologists, researchers, policymakers, we really can't tell what might come next. And Delta has really shown that to us. It's been, you know, unprecedented, really, the impact that it's having on both our nations. We've seen a recent outbreak in China, in Nanjing, just this week, the Delta variant. So no country has COVID under control. And so how can we work better to make sure that we try to do so? And it's been said that there might be 6 main areas that we can collaborate better. So first of all, making sure that there's a cognitive ability of leaders and government efficiency of action. Second of all, working to build that health system infrastructure that I talked about earlier. So reducing that fragmentation from community to hospital and building that equality of access to higher quality services. Number 3, increased usage of technology, whether that's vaccine development, whether that's internet hospitals, whether that's better disease monitoring, track and trace, and so on. Number 4, strengthening health protection laws and regulation, including quarantine, travel restrictions. Number 5, improving medical insurance, including relief systems for populations most at risk and most at need, and making sure there's emergency material support systems available when they are needed. And number 6, reforming disease prevention and control systems. And we've seen that in the UK with the restructuring of the health ministry, with the new UK Health Security Agency. And in parallel, actually in China, they're rebuilding the CDC, the Center for Disease Control, into a new health security bureau. So it is interesting to reflect that the governments are working, mirroring each other and focusing more on building health security better. So again, finally, as Linda said earlier, these areas are relevant not just for the hot topic of today, which is this pandemic or perhaps a future pandemic, but we need to focus on a more long-standing resilience as health professionals and health-focused experts. And perhaps health has always been a priority, but it's important, whilst we have this opportunity and the attention of higher politicians and wider policymakers, to use this focus on health right now to strengthen our health systems for non-communicable diseases, for the aging population, in order to protect and build better global health security. So I'll stop there. Thank you very much.
Ruby, that's a lot. And Linda also has covered a lot. So thank you really both for doing that in such a short space of time. I just want to remind everyone in the audience that this webinar is recorded and will be on YouTube at a later date. So you can come back to it, because I think we've covered a lot of points so far. But in handing over to Chun-Yi, I'd just like to touch on something that Ruby mentioned, which is Build Back Better. And I'm not going to try and do some Boris Johnson impersonation here, because it's a catchphrase that can mean many things. And Ruby, obviously, we're asking you to talk about sort of what are the differences in strategies taken by Taiwan and UK governments, or Taiwan and any governments perhaps in the West, to counter COVID-19 and in relation to public health. But perhaps you could then also talk a little bit about, for Build Back Better, what comes next. Do you see a difference between the East and the West? I mean, Asia and Western countries, because you and I talked a little earlier about SARS in 2003, and we learned a lot from SARS in Asia. And a lot of those things were ingrained in collective memory. And I wonder, as you talk a little bit more about Taiwan going forward and your experience in the UK, do you think in the West we will have less collective memory from this pandemic to influence our public health policy going forward? Do you think that's stronger in Asia? I know we're getting onto some, not just public health policy there, but social policy, which I think is your domain as well. But I'd love to hear you talk about first the differences you see between Taiwan and elsewhere.
Thank you, Martin. I'm very honored to be in the panel, and I learned a lot from Linda's talk previously on all the interviews that I've learned, of course, and of course today. And Ruby, particularly because I respect you are not only as me as just a fake doctor, you are a medical doctor. You've worked at the front line. And so this is my honor to be here. And I just wanted to say, I never thought in my research would be encountered medical research, because I'm trained as political economist. The pandemic gave me this opportunity to work with the team in Taipei Medical University, and also in Nottingham, the medical management, Professor Steve Hansen, in a sense that we were working together to see this is an interdisciplinary puzzle to us all and globally. So in answering, Martin, your good question of what are the different strategies of the government's responses towards COVID, this is the very question to push me into the research I am presenting now to the audience, because I saw a very different responses from the early days of the pandemic in 2020 January till now. But I would like to separate of the responses into the three main areas. The first is the border control, which Linda already touched upon in her talk. And what I wanted just to remind all of us that actually in the UK, the border control haven't been a strong control in the UK government. Boris Johnson, our Prime Minister, said that it's not practical to control the border in 2021 February. And actually, the mandatory hotel quarantine only started in 2021 February 15th. So it has already been a long time, and that contributes a lot of what happened in the UK. In Taiwan, border control started by end of January 2020. You could say that was because of the great mistrust of China, in a sense of back then they called coronavirus as Wuhan virus. Of course, later on changed the name, but it also started based on what we discussed before, Martin. It was the mistrust of and the pre-awareness of this potential pandemic. So Taiwan has tackled or blocked the border much way earlier in comparing to many other countries. So it's just a very drastic contrast towards the UK government on that front. The second strategy I wanted to say is the track and trace, which both our previous panelists touched upon. And what I wanted to say is the track and trace is not just about the app. Here in the UK, we subscribe to the NHS app and the track and trace. And later on, now we are talking about a pandemic, right? So if you get a ping and you would wonder whether it should quarantine or not. However, in Taiwan, the track and trace is not just an app, but also they have, when you arrived in the country, you would be going into the special quarantine driver bus toward the hotel. And then they will have person to actually come to friendly check on you. In that sense, they would make sure that it is traced of all the arrivals to Taiwan. And whereas comparing in the UK, even in the earlier time, not now, like in way back in September or October last year, the track and trace is by the citizens' good willingness to stay home, to be quarantined. I wouldn't see anyone actually to check on you whether you are quarantined yourself, right? So that's another differences that I would say. So the track and trace, in a sense that it is not just by the app digitally, but also there would be people come to check upon you, to send you some foods or some necessities for you to sustain those quarantine time. Yeah. And the third point I wanted to say is the digital means to combat COVID, which Taiwan's digital minister, Audrey Tang, have already said a lot on the digital means. That she mentioned in April 2020, Taiwan was able to use the digital e-footprint to distribute the mask. Back then, mask was really important for all people, actually still now, to acquire mask, but there was a shortage of mask. So the digital means was able to guide people to the pharmacies that to provide sufficient mask for the citizens. You don't need to queue in different pharmacies in that sense. But what I wanted to mention more on the digital means is not just about the mask. It's about the digital IT card. All Taiwanese citizens have a NHS card, NHI card, National Health Insurance in Taiwan, NHI card, to document our in a sense of the travel history, occupation history, contact history, cluster history. So one card, you would be able to know all of your traces in a sense. This has been established prior COVID, based on what? Based on Taiwan's lesson learned from the SARS. okay? And to my learning of the project, I understand there's not even an ID card in the UK. So my Taiwanese colleague was asking me, how could the UK medical management to actually know where you've been to if you don't have any card traces for you to, for the government or the medical bureaus to know where you've been to? There's no trace you could be seen. So I think the issues of the digital or digital means to combat the COVID, it's established way before this pandemic. And it probably would be a good question for the government and medical management team to think about it, if that would be able to actually establish something, a system that being consent between the cities and government to accept that if you want it to be protected, you would need to consent to release some of your personal data in a sense. That's what happened in Taiwan. Yeah. So all that, what I wanted to say is, one thing I would definitely say in the UK government strategy, turning the table around was the vaccine rollout, the massive and efficient vaccine rollout since December last year, all the way around. That actually boosts a lot of the citizens in the UK's confidence. I'm not sure it's towards the government, but I'm very sure it's towards the NHS. And I learned that NHS is not exactly the government, because people would be willing to, it's the trust of the NHS of the British people, and then willing to take up the vaccine. And myself, I've seen the vaccine roll out in this country. I use this word, wartime efforts, because I was taking the vaccine at the church, not at any clinic. And you could see that was in May, the first dose. So I feel like it is everybody made efforts to roll out the vaccine. And also people was willing to take it. Of course, you would say that there's still a lot of the mistrust. Till today, the vaccine take-up rate, the first dose is over 88%, and the double dose is more than 70%. And that is quite impressive. Whereas now I come to Taiwan, it's not that great in terms of vaccine take-up rate. And as Martin, you just said at our previous discussion, Taiwan actually entered the COVID warring time, let's say COVID outbreak in this year, mid-May. Till now, the death toll of Taiwan is 784. You would say it's quite small compared to we've learned from the UK and also from the USA. But to a small island, Taiwan, that is something. I would say, in my very cautious optimism, that Taiwan has been sort of under control now. But the vaccine rolling out is a big problem in Taiwan. Yeah, there are several issues. Difficult to get supply. Taiwanese President Tsai Ing-wen said that China factor here. Yeah. So the civil society, for instance, Terry Guo from Foxconn bought vaccine, and also Chun-Yi, the Buddhist organization, also bought vaccine for Taiwan. And then also, that is apart from the difficulty to get vaccine supply, it is also difficulty to convince people to get vaccine. The extraordinary exaggeration of the getting the AstraZeneca vaccine in Taiwan, I would say misinformation quite a lot, really push away for people to get vaccine. Unfortunately, the most vaccine Taiwan can get now is, or can buy, or can be donated by the Japanese government, are AstraZeneca. So that creates quite a lot of difficulty. Yeah, Taiwan is wanting or wishing to push out a national vaccine, but we have to see whether that will be out by early August and can be actually past the trial periods. Yeah, but Taiwan is working on that. That's a good sign. And Taiwan also works on producing Moderna. Yeah, so Taiwan from September will start to be the contractor to produce Moderna.
Sorry, could I just jump in as you talk about vaccines, because I think you've come to a very important part of the whole discussion. And if I could, I'd like to sort of dwell on vaccines a little bit and talk about some of the social impact and social issues around that. And perhaps first jump back to Linda, if I may. So we have a question from Guy Jubb, who's quite a regular attendee, who said, do you anticipate there will be antipathy or opposition in the UK when it comes to getting booster injections? And if so, how should this be anticipated in public policy? And sorry to burden you, Linda, and all of you with multiple questions together, but another question related from SH in the audience. How are we dealing with the anti-vaccination protests, and especially the now struck off nurse who's been making some bizarre statements? Social media seem to be sadly a platform for anti-vaccination, but we can read about the anti-vaccine campaigner who died from COVID-19. How can we persuade young people who believe they're invisible to actually get the vaccine? So there's a lot of questions around vaccines, booster vaccines, supplies, persuading a population. And Chun-Yi mentioned a great difference between Asia and the UK just now. When you mentioned we don't have an ID card in the UK, Chun-Yi, I had an ID card in Hong Kong for 32 years, and everyone takes it for granted. You give your ID card number wherever you go for every government purpose. I don't think that would work in the UK. There's a great antipathy to central collection of data. So Linda, perhaps you could help us first. How does that relate to future vaccination as part of public health strategy towards COVID-19?
Thanks very much. So I'll try and be brief because I'm conscious of time and hearing from the others, but thanks to Guy, SH, and also your comments there, and Chun-Yi, both Ruby and Chun-Yi were so eloquent and made some points I've really learned from. Guy, on the booster campaigns, the HPV vaccine for cancer, one of the cancer vaccines, was originally a three-dose regime. So I was involved in some research on that. It's now 2 doses because there were some issues with getting that 3rd dose taken up and lower levels of uptake. There are some concerns about the boosters, but as Chun-Yi has says, this wartime effort in motion, I think, will continue well into the autumn. I imagine the uptake will not be the same level, but it's likely just to be older and more vulnerable groups. I'm still very confident it will be very good, and we have the infrastructure to deliver it. I think there's a question mark about the longer term annual boosters, like the influenza campaign, where we normally only get 60 to 70% uptake. So wait and see, but I'm feeling optimistic about this autumn. For all countries, populations will need to know what the evidence on waning immunity is, particularly for older groups. We're already starting to see those data come through from Israel and elsewhere. Second, then anti-vax, very unfortunate. It's an international phenomenon. I think it's less of an issue in the UK, although the voices are very prominent. Over 70% of 18 to 29-year-olds have already come forward for their 1st dose. So we're really getting there with that age group. I do think we can address it, but there's always going to be a proportion of the population who are following that. And there's some tremendously powerful forces behind that movement, both funding it and driving it on social media platforms. So that's an international challenge. And then the final one on the identity cards, just to comment on Chun-Yi's comment about the AZ vaccine. The AZ vaccine has been highly problematic internationally, and it's so regrettable because it's such an effective vaccine. And the minimal risk from adverse events has been blown out of proportion. So there's a big reputational problem for that vaccine globally, not in the UK. ID cards, as you rightly say, Martin, hugely controversial in the UK pre-pandemic. Quite how we get there. I like Chun-Yi's language around protection. Sadly, a lot of people in the UK population wouldn't see it that way. So we have a big task ahead of us. If only we could have more of what you have in Taiwan on that front, but I think it's going to be a challenge. Thanks.
Thank you very much, Linda. And we're speeding up, everyone, because we're down to the last 10 minutes, and Linda has to do another TV interview after this. So we'll keep going quickly. But I'd like to bring in another question from the audience. As we have a panel of women, I think I'd like to ask something that I think you should have some comment on. A question from Slippy or Shilpi, excuse me if it's mistyped. Due to the surge of COVID-19, how are we going to deal with child abuse and the violence to them and women in developing countries? As it is increasing due to the increased lockdowns, which lead to poverty and continues with that chain, is total lockdown really helping the situation or worsening it in developing countries? Ruby, could we start with you there? Because I think we want the perspective from China, but we're not picking on China. Obviously, lockdown has been or was a key part of the public health interventions in the PRC. And lockdown there really does mean lockdown on a very local level. But we're clearly seeing in the UK the psychological effects of lockdown on parts of the population. And it seems the most vulnerable parts as well. Obviously, that's relative across different countries. Lockdowns can't be enforced in certain countries, but could you say something about not just lockdown, but what you see as the psychological impact of lockdowns and other public health interventions, both in China and in the UK going forward, and the impact on vulnerable members of the population, women, children especially?
Yes, thank you, Martin. So I think this is a really great question and a really important one. I'll kind of talk about the total lockdown part first. So actually in China, they had total lockdown January to April of 2020. And since then, the country, although it's been relatively sealed off from the outside world due to very strict travel restrictions, inside China, life goes on as normal. There's been no whole country lockdown since the Wuhan lockdown at the start of the pandemic. And now, you know, I remember when I came back to Beijing in September 2020, straight from London, that the change was just so drastic. Everyone was living as normal, all restaurants, all public spaces completely open, no social distancing, a lot of mask wearing, yes, but there was practically zero COVID in the country by then recorded. So total lockdown at the start of 2020 in China you could argue led to the country opening back up so quickly as a result. Now, there are so many other factors which we've all been discussing today: societal, public recognition of laws and restrictions and compliance, and characteristics of society, etc. But really, it's really interesting seeing how impacts of policy are kind of dispersed into the community and who listens. And that's not just for lockdown, but as we just mentioned, for vaccine uptake as well. In terms of COVID impacting the wider health of populations, so in Shilpi's question, talking about child abuse and violence to children and women due to restrictions, I think that is a really big issue. And it's been exacerbated by lockdown. And another, you know, what we call as the silent pandemic is really the issue of mental health and how that's been exacerbated as well through COVID and social isolation. So I think these are really, really important health challenges, but it goes back to what we were talking about, all three of us, the panelists, in that COVID has highlighted existing healthcare challenges. So in order to tackle them, it's not just about this kind of short-term response, but a longer, more sustained, more rooted health system infrastructure building that is really important, and particularly how social care integrates into healthcare. I think that's something that the UK, although we have a lot to work on, is actually relatively strong in and is a leader compared to many nations in the world, particularly developing countries. And that's to do much with how primary care is more than 70% of healthcare services in the NHS, how that contributes towards lower quality, greater access to patients, there's a long way to go for sure for the NHS. And I think, you know, as the UK, we need to look at how we can make that stronger to address the issues we've had throughout the pandemic. But definitely it still presents a lesson to be learnt for many other countries where primary care is not so strong, where social infrastructure is even weaker, and where there's more disparity for different communities. And it's really those communities that are already vulnerable with lower social economic status that are at greater risk. So this is a massive issue. And I think in addressing this, we must kind of take a step back. So to look at short term, but also long term.
Thank you very much, Ruby. We're really close to running out of time, but I'd like to put the last question to Chun-Yi if I could. And I'll read a question from Graham in the audience and then adapt it a little if I could. Graham asks, there's been an erosion of trust in the integrity of governments and institutions such as the World Health Organization. Why? In part due to the erratic advice being given, misleading use of statistics, the use of psychological techniques to modify behavior. So how best to restore trust in the system? So Chun-Yi, could you say something about this from an Asian perspective, and also being here in a UK university at the moment? Is there less trust here in the UK in government and in experts? Sorry, I'm afraid all three of you are experts. I think we'd all trust you, but some do not engender trust. Is there less trust in the UK than there is in Taiwan and certain countries in Asia? Is there more trust in governments in Asia in the response to the pandemic and the public health policy that comes out of the pandemic? How would you see the differences between Asia and here?
Thank you, Martin. I think, yes, East and West, this is a question, right? We tend to think that the East people are trusting more on the government and the West are more rebelliant. But I think one also need to look into, if we take into this pandemic as a case, we need to look into government's message. In the UK government, it's flip-through. It's sometimes going this way, or it's randomly, or government would contradict itself, which Linda would know the best. How can people listen to which message? This is a question, and this is the key to the trust. So if the government can deliver the message at the crisis pandemic clearly, and not to be really bothered by whether this message would impact on the voting, on the voters' decision, I think that would gain the trust. I'm not saying that Taiwanese government is the best, because Taiwan also is a democracy, that there are two parties to compete. Yeah, but it's to see my question. I probably can't really answer your question whether East people in the East trust more of the government. What I wanted to say is, what I see into this question is whether one government can actually deliver the message clearly and not to contradict the message because of worrying about the voters. Taiwan also experienced the same issue of the voting as a democracy, but that's how Taiwanese government so far trying to be formulating a more coherent message to people. Yeah, that's probably not the answer to you, but my take of this question.
Actually, you answered the question perfectly, because as you said, if governments could address their populations without primarily being concerned with gaining votes, then we would probably have better communication from governments. Unfortunately, I think it's sadly not the case. So you've really hit the nail on the head with the closing question. I think if I could, I'd really like to ask all of you to come back tomorrow or come back next week, because we could keep going, and really there's much to learn from all three of you. But unfortunately we have to stop. And Roddy, could I hand over to you for closing, please?
Martin, yes, thank you very much indeed. And thank you for enabling this webinar to happen. Judging by the number of followers and the number of questions, it's generated intense interest. And we're very privileged to have heard from the three panelists who have, without any doubt at all, increased our knowledge substantially of a hugely relevant topic. Lessons learned now, lessons to be learned in the future, that are going to affect the way in which we deal with issues of this sort. So to Linda and Ruby and all of you, thank you so much for what you've done and making this such an important panel and discussion for the Asia Scotland Institute. Thank you.